Hi, my name is Yindia, and I'm an RN currently in the ECPI University Online BSN Nursing Program. And I'll be presenting my senior nursing project titled Enhancing Critical Care Nurse Competency, Simulation-Based Approaches for ICU and Burn ICUs. This is for Nursing 456 under a Dr. Townsend. Today, we'll be exploring the important role of simulation-based training in building critical care nurse competency, specifically within the ICU and burn ICU environments. We'll also explore how to effectively design, implement, and evaluate simulated-based approaches to ensure our healthcare professionals, particularly our nurses, are prepared for high-pressure critical care scenarios. The need for competency nurse critical care is important. The ICU and the burn ICU environments are high stakes, so any errors made in that field could result in patient severe consequences. Due to the complexity of their environments, it's imperative that the nurses are able to make quick decisions and interventions on behalf of their patients, according to the American Association of Critical Care Nurses and the Society of Critical Care Medicine. However, it's been found that there are knowledge practice gaps. And in short, the traditional methods of sitting in front of a computer or just reading a book, it's just not cutting it. That's where simulated based education sessions comes into play. The practice standards are constantly changing and evolving. And the nursing skills and competency need to be able to reflect that. That's in accordance to the American Association of Critical Care Nurses and the Society of Critical Care Medicine, 2023. It's also shown, according to adult learning principles, that when adults have experimental learning and immediate hands-on application, they learn better. That's according to Knowles et al. 2020. When designing simulated-based assessments, first you want to conduct a needs assessment. You want to be able to identify specific critical care areas that are requiring the competency training. That's according to Pollitt and Beck of 2022. You want the learning objectives to be clear and aligned with the desired patient outcomes you're hoping to achieve. You want the scenario development to be as challenging and realistic as possible so that your nursing staff can get the best out of the simulated based sessions. And then, with fidelity and realism, you want to be sure that you have the right equipment and the right environment and time allotted to run the simulated based education training effectively. That's according to Mayer 2020. And then lastly, your assessment rubrics. You want those to be fair and consistent, engaging whether or not the education was effective. When implementing simulation-based resources, you want to be able to provide structured debriefings. You want to allow for self-reflected assessments and encourage peer feedback. You want the nursing staff to be able to identify their own areas of improvement. That's according to Brown and Jones of 2022. The faculty training is also a key factor. Your instructors should be knowledgeable on both how to conduct the simulated-based education itself and the structured debriefings that should follow. You want to provide supportive atmospheres and safe learning environments. You want your personnel to feel that they can perform at their best, make mistakes, and learn from those mistakes without the risk or threat to patient harm. Your resource allocation is also crucial. You always want to be sure that you provide enough resources that includes personnel, equipment, and designated areas to hold the simulated-based training sessions themselves. And then lastly, you want to have a smooth transition into your current curriculum. This is a repeated process. This is very important in ensuring ongoing staff development. When evaluating your simulated-based initiatives, you want to be able to conduct pre and post simulation quizzes to gauge the effectiveness of the knowledge throughout the course of the training session, according to Cantrell et al. 2023. Your skill performance observations directly correlate to the established rubrics that you have throughout the simulations. You want to have self-reported confidence level checks before and after the course of the simulation because you want to see an increase in the staff's reported confidence levels. You want them to feel prepared after a training session. That's according to Cantrell et al. Also 2023. When it comes to transfer to practice, you want the patient outcomes in the actual ICU and burn ICU settings to be closely related or mimicking the simulated-based training sessions that you held with the staff. And that's according to Pollitt and Beck of 2022. So realism and challenging environments are important. And then according to your participation feedback, this is what is going to ultimately gauge the effectiveness and the quality of your overall SIM experiences. The benefits of having simulations in critical care are many. You have enhanced clinical decision-making. Again, your staff is able to practice in safe environments without the threat to patient harm. Improved teamwork and communication. You have teamwork collaboration, and you have a promotion in team communication. You have skill mastery and retention and skill refinement. When you're able to merge your hands-on with the knowledge application approach, your retention is better. You have better identification of knowledge gaps, so you can spot areas of weakness even quicker, and you're able to address them faster. And then again, you have the increased confidence and preparedness. In short, your nursing staff develops resilience and they feel prepared to handle potential unknowns within their high pressure environments. The journey in critical care is a continuous one. Due to their dynamic nature, new guidelines, technologies, and best practices are constantly emerging. That's according to the American Association of Critical Care Nurses and the Society of Critical Care Medicine, 2023. Addressing the knowledge practice gaps, your simulated education-based approaches helps to bridge those gaps. Because again, when you make and design these sessions to be as realistic and challenging as possible, you help bridge the gaps so they're not going into situations of unknown territory. They feel capable and confident to handle whatever is thrown their way. Again, according to the experimental learning or the adult learning principles, simulated training and hands-on approach, adult learners thrive in those kinds of environments. That's according to Knowles et al. 2020. And this supports the cycle of continuous improvement. And where you have continuous improvement, you have sustained competency. And competency aids in adaptability. In conclusion, simulation-based education is an invaluable tool, and it's a cornerstone. Through the systematic approaches of effective programs and structures, you have continuous improvements through feedback and data, which helps fuel your ongoing future education-based initiatives. Your patient safety is always a priority. And through those simulated-based education sessions, they directly align with your patient outcomes and safety. And of course, as always, simulation-based education sessions are a definite investment in excellence. Thank you for your time, patience, and attention today. Please feel free to participate in a brief knowledge check by clicking the link below, or follow up with any comments and questions for further discussion.